indeed the public service agenda become reality? This will be today's task, today's question, so I hope very much that we will have very interesting presentation, very intense debates. I mean, we all know this is always very limited, sometimes with the webinars, but we really hope that you enjoy.
Thank you very much. We'll try to address all these questions you posed today together. And as you said, I'm Karolina ZBYTNIEWSKA, the editor-in-chief at Euractiv Poland, the media partner of this event, and I will have a pleasure and honor of chairing this timely debate.
That we need to think more about people and their needs, and that we also have seen how important on the one hand and on the other hand challenging it is to accelerate the digital and green transitions, keeping in mind that all these aspects are linked.
All of us remember the emotional moments of people applauding healthcare services or other protective services at the early days of the pandemic, when being stuck at homes during the lockdowns. But at this moment in time, indeed, it is important to look beyond that.
What we need to pay attention to in representing the interests is we need to have clear employment laws. We need very clear rules and regulations on this.
Unfortunately, there was no surprise, and I would say that we must be even proud of our members that despite difficulties have been able to keep providing services 24/7 to the citizens, the territories they serve.
And I think that we saw a number of issues coming out of the COVID-19 situation. And the first is what's already been mentioned, which was underinvestment. I mean, it was quite clear that we couldn't replace staff who had to go into quarantine at the beginning.
The investment needs to go there so that people go to the hospital less, because we can detect problems earlier, so that the hospital can focus on only the cases which are the hardest to solve, and then they have the adequate resources. But to do all of this, of course, there needs to be more governmental support, and to do that, I think we need more EU support.
I think you cannot undertake this massive transformation that we're looking at of many different organizations in many different contexts if you don't have the backing from the top. And that means for elected officials that they might not always understand what's going on, right? They might not always have the detailed knowledge of what needs to be done, but in order to make this successful, we recommend that they do get involved and they do stick their neck out and they do back up the efforts of their staff in their respective organizations.
All these things, even if we have an action plan, will likely remain just words unless drastic conceptual changes are going to be made. So that's why I'm referring to redefining or redesigning the social contract.
I would like to very briefly summarize what I have taken from this meeting. First of all, that the COVID-19 crisis has exposed structural weaknesses in the sectors, and I refer also to what Otto said. He said first it was the police and the healthcare sector, and then by the end of the day it was concerning all public sector. And I would refer also to what Heather said, that there were, generally speaking, there was a general referring to a specific sector under preparedness. So we have, I think, a strong case to claim that EU member states and European institutions must set a strong public service agenda to prepare for the future.
Public services were already under pressure before COVID. There were a number of structural changes which were affecting our economies, from demography, changing labor markets, to public finances and the fiscal consolidation, which is needed in many places, to rising inequalities, to a changing social contract, to different ways of delivering key areas of public services like education and health, to the digitalization, the new technologies. So all of this was already impacted. and now with COVID, that has increased that effect. But I would also see this as an opportunity.